All right, so today, really good news. We have 112 active cases at the moment in Shepparton for people that have tested positive with COVID-19. So that's a reduction from yesterday's results, which is really pleasing. Overall, 19 people who have been positive have now been cleared by the contact tracing team, which is good news, and hopefully that will continue in the coming few days. There has been 4 new people testing positive as well. Those people are all in households that were expected and linked, and they've also been in quarantine for that period of time, which is good news. On the good news front, we're really pleased with the results of the day 13 testing that was carried out on Thursday, and then the subsequent clearance of people from their 14-day quarantine period. So as of late last night, there's been a total of 4,485 people that have been cleared from quarantine. Again, that's a 2-step process where those people will have received a text message or email from the Department of Health, and then to actually release them from their quarantine. But the first step, of course, is the negative test result from the pathology provider. So for those who haven't quite got their results yet or been cleared, again, the first step is the negative test result, and second step is the formal communication from the Department of Health. Just in terms of the communication from the Department of Health, that can come in a couple of different formats. It could be in a text message, or it could also be in an email. It could go to the parent or guardian, and it could also go to the students, their own email address or their own mobile number as well. The reason why there's some variation in that is because it really depends on when people were going into isolation and notified as being a primary close contact, what details were provided. So please, if you haven't received that communication yet, check those sources, your email addresses, your phone, of course. But if you've got any queries, you can then call 1800 675 938, and that's the coronavirus hotline, and the people on that call will be able to help you out. There is a small issue with around about 130 families at the moment in relation to the communication for their clearance. It seems to be affecting people from St Mel's Primary School and Notre Dame College. There's been a little mix-up in terms of the communication between the various databases, so people have had, unfortunately, a delay in receiving the communication about the conclusion of their quarantine period. That's been worked on as a priority this morning and now at the moment, and we're expecting those people to have their formal communication from the Department of Health this afternoon. So we're sorry about that error, but it's being corrected as quickly as possible, and hopefully people will receive that message in the coming few days. Just a reminder as well that in terms of people being cleared, the primary close contacts will receive that message from the Department of Health, and that then automatically means that the secondary close contacts are released from quarantine as well. Looking ahead, our focus, of course, in terms of not only managing the outbreak is in relation to vaccination. So we're really keen at GV Health and right across our partner health services to improve the vaccination rates across our local public health units area. At the moment in Shepparton, there's a total of 45% of people who have had their first dose of a COVID vaccine and 26% who have had the double dose. That's not where we'd like it to be, and there is now, from our hubs and the spoke sites that we're operating across the region, there is increased access hours in terms of appointment slots and times that people can make bookings to be vaccinated. We've opened additional Tuesday evening sessions and Saturday sessions at the Macintosh Centre here in Shepparton, and we're looking to increase more sessions subject to supply of vaccine in the coming few weeks. If you haven't booked your vaccine yet, you can do that at coronavirus.vic.gov.au. It's an online portal. There's also the 1800 675 398, the coronavirus hotline that you can book your vaccine in. And there's general practices as well as pharmacies where bookings can be made for vaccination. GV Health as well has done some good work with Dyson's Bus Company, a local transit firm in Shepparton, and yesterday we shared some information with the community about Jabba the bus. So Jabba the bus is a really terrific idea, I think, from our staff that have come up with the concept of having a normal bus that people would catch around town, a typical bus of that nature, converted to be able to deliver vaccines to people, of course in a safe and proper manner. But really the whole purpose of Jabba the bus is to be able to take vaccination to people that for whatever reason may not be able to make it to a vaccination centre or a GP clinic. So the idea is that in certain geographical locations where people may not have access to public transport or may not be able to drive themselves, that the bus will be rolling around the Goulburn Valley as well in coming weeks. So more about that on Monday, but from Tuesday next week, Jabba the bus will be moving around, certainly around Shepparton and other areas beyond that as well. So happy to take any questions. Probably the only other thing, to add is that out of the 4,485 people that have been cleared from quarantine, there has been 0 further positive cases in that group of people, which is really pleasing, a pleasant surprise in fact, but you know, it's different to what we've seen in other outbreaks in Melbourne, for example, but it just speaks volumes, I think, to people who have done the right thing during their isolation period and stayed at home, however difficult that has been, but it's really paid dividends in terms of where we're placed now as a community. So hopefully people can start to get back to a normal life, subject to all the other directions we're living under. Thanks.
And I'm assuming you processed the bulk of those day 13 testings from that big volume on Thursday?
Yes, that 4,400 number is all of the good work that everybody did on Thursday across the testing sites and the community members that came out and were tested.
And is it a more positive sign that we haven't seen those positives from those day 13, but also we've seen stabilisation in the numbers of other people in the community?
Yeah, it is really positive in the sense that we're starting to see the numbers tail off. So that today is the first day where we've actually seen a decline in the number of active cases, and hopefully that trend continues in the coming few days as you know, people are reaching the end of their quarantine period where they're retested, and hopefully more people will be released.
In terms of our comparatively low vaccination rate, what do you think some of the key issues have been in Greater Shepparton in terms of delivering those jabs or getting people to step up for having one?
So there's probably a couple of key reasons. So initially the vaccine rollout was really targeted at high risk areas. So people who worked in, say, ports of entry and other locations like hotel quarantine where there was known high risk locations in terms of they obviously had people who were transiting through those areas or staying in those locations that had COVID or had a high risk of having COVID. I think the challenge has also been the well publicised and known issues in relation to vaccine supply. That's been a challenge, and then obviously I think people have been a little bit hesitant in relation to the AstraZeneca vaccine, but I guess my view is in relation to vaccination, it's really the only way that as a community and more broadly, you know, as a country, that we're going to get on top of this pandemic. And again, the best vaccine is the one that's in your arm, as has been often referred to in recent days. So the simple message is, if you haven't been vaccinated, they are safe and they protect people from not only catching COVID-19, but you know, in terms of what we're seeing with rates of hospitalisation and how unwell people are becoming with the Delta variant, you really must get vaccinated. It's the best way to keep you safe, and not only yourself but your loved ones and people in your household as well.